Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending quite a bit of time today discussing a topic that never fails to generate interest on Facebook chat groups, in conversations with agents across the country, in meetings that deal with helping our Medicare population with their healthcare choices. And this is a very valuable subset of that audience, and that's dealing with the folks that have served our country in a military capacity and as a veteran have different choices for their health care. We go beyond that today, outside of the fact that we're going to deal extensively with healthcare choices for folks with just plain veterans benefits, folks with TriCare for life benefits, folks with CHAMP VA benefits. But we'll go beyond that as well toward the end of presentation to briefly touch on some of the things that Medicare doesn't cover that veterans need assistance with as well. So please bear with us till the end because this is a long presentation, but we have a lot of detail and we'll be carrying through the conversation very quickly and recording it. It will be made available on our website at premiersmi.com and on our YouTube channel as well. And the information will be available to you through your Premier marketer, your Premier agent, success manager that you work with. If you aren't working with one of those, we will, of course, make certain that we set up an arrangement with you. In addition, we will be sending an email follow-up to those who have raised their hands in interest to today's presentation. You'll notice in the software package that there's a section for both questions and chat. We ask that you put your questions in the question box, and while we cover the majority of questions we found through a presentation such as this, during the course of the presentation, we'll make certain that we address all the questions that are there as well. As a bit of level set, let's give you a bit of idea as to who Premier Marketing is. Some of you may be more aware of us than others, but we're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country, licensed in all 50 states. We act as an insurance wholesaler working through independent insurance agents such as yourself, with contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full portfolio of products. And this is really pertinent to today's conversation because we'll reference just about all of these throughout today's presentation. And it includes the base medical coverages for folks on Medicare, including the Medicare Advantage and Medicare Supplement plans and the standalone prescription drug programs. But additionally, we offer a full portfolio of life insurance and annuity products, including final expense and pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, hearing, critical illness cancer plans, hospital indemnity programs, accident plans, and even a telehealth program. That Medicare Advantage portfolio, very comprehensive. It has all the national carriers on there for you. And in addition to that, many of the strong regionals that will make a difference for you in your market. Particularly interested of today's topic, many of these carriers are now offering the give back, buyback, whatever you want to call it, where they refund or subsidize a piece of the Part B premium. And that is a program of great interest to many people who are accessing VA benefits. Our same philosophy of the Medicare Advantage offering carries over into prescription drug plans. You'll find that these programs are generally part of the MA contract. Exceptions, Medicare PDP programs through Mutual of Omaha are separate contracts. This is one specifically for their Part D program. And the Clever RX program is actually a discount program and not a sanctioned prescription drug program through the government. Medicare Supplements, they apply to today's discussion in certain circumstances. Like everything else, we need to do a bit of a diagnosis. But you'll notice that this is a very comprehensive list of Medicare supplements, and we have different programs set in place to help you be successful in this space as well. Same thought process with the ancillary products. In each of these categories, the national leaders are there for you through our organization. Creates a great way to address specific needs for our prospects and clients, create another revenue stream for us, and almost as importantly, gives us another way to market to the public, be it our book of business or the general public as well. When we speak of the Medicare market, opportunity overall, we're looking at a near exponential growth in the folks that are aging into Medicare. And so we have a burgeoning market here. You don't come on a presentation like today without hearing of the silver tsunami, the aging of the baby boomers, one every 10 seconds, 10,000 plus a day. If you look at things based just on age, very true, near exponential growth, but we're seeing a number of individuals that decline their full Medicare opportunity for one reason or another at age 65. Many are working past the age of 65 now and are accessing benefits through work. Some folks are pushing that back simply because they want to work till maybe age 67 to get their full Medicare, Social Security benefits. But we see a number of folks not accessing all their benefits when they turn 65, more than made up by this section, where the folks that are under the age of 65 accessing Medicare benefits because of disability, well, it's 15 to 17% of the population, big piece of the market that we pursue. And it's important that we look at things on a bit of a holistic basis, simply because the Medicare population, including the veterans population, and in many cases, particularly those that have served our country, we're seeing folks in this population that, well, 2/3 of them have 3+ chronic conditions. Income and assets can be a bit of a challenge. Other things can come into play, including long-term care stays. We want to make certain that we have options across the board to handle this population because they have choices. And this is particularly pertinent to the veterans population because one of the first choices is, do I keep the optional Part B under Medicare? We see within the veterans community, perhaps a greater percentage of individuals decline that as opposed to the general Medicare population because they feel comfortable in accessing benefits through the VA administration. We can see through our discussions on how to address that and make certain that we're able to help people in that situation should additional information make them realize that perhaps that was a rash decision. Some of the folks on general Medicare then will self-insure for the shortfall in the medical expenses under original Medicare and perhaps pick up a Part D prescription drug program to handle some of the prescription costs. This is a topic that we'll discuss in great length in just a little bit. Some folks will pick up a standardized, modernized Med Sup in order to cover that financial shortfall within the cost of medical care. It applies to a portion of the veterans population. And we see a number of folks now, an increasing percentage, that are choosing to bundle, put all their benefits into a singular package known as Part C, Medicare Advantage Plans, a big topic for today's discussion, since many of these programs now offer a particular benefit that's of interest to the veterans population, and that is what boils down to a basic partial subsidy of their Part B premium. I mentioned the fact that the Medicare Advantage plans are gaining in popularity. Part of that is because the aging of the Medicare population has individuals aging in more comfortable with a network-based program, and the pandemic has had a bit of an influence, or at least it's a barometer of some of the choices that are changing. In the past, it's been a fairly even choice between Medicare Advantage and Med Sup entrants based on people coming into Medicare, if they're first aging in or whatever. And we're seeing that change a little bit within the population that's becoming more comfortable with virtual care, things of that nature, where the Medicare Advantage plans are on a bit of an upstream. You'll see in this portion here, however, that there is a section of Medicare that is shown as Medicare only. And this may well be where many of our folks that we discussed today with veterans benefits are in that category because they haven't picked up an MA or a Med Sup program because, well, they're comfortable with VA benefits or perhaps aren't aware of some of their options. This also covers folks that may have retirement coverage that, well, could contain a number of veterans as well because they may have retired and then gone into the private sector and have benefits available there as well. It also contains folks that are both Medicare and Medicaid. Once again, a good section for the veterans population. And then, of course, the folks that haven't chose any other type of coverage. and are accessing care only through traditional Medicare. Once again, a valuable subset for us in today's discussion. One of the things that we want to make certain that we do, though, is be able to translate some of the acronyms that folks encounter in our discussions. And we see for folks that are veterans that they have kind of an actual additional piece of acronyms that we have to deal with. We have used in the past an acronym guide from the Medicare Learning Network. They recently discontinued that program and are asking us to use the CMS acronym guide, hence a new picture for those of you that have been on our webinars in the past, a new location to send people to for a translation of acronyms. This also reminds us that in our discussion with folks, we need to make certain that we limit some of the use of acronyms on our side in order to make certain that folks actually understand what we're speaking about. So a good thing to remember there. It's important for us to go through all of this, particularly with the veterans population, because many of them do not think there are other options that they should examine, don't examine their coverages year over year, but that's part and parcel to the entire Medicare population, regardless of their base coverages. They're not looking at their plans and reviewing them year over year as they need to because benefits and costs change. And that is particularly also an issue with folks that have just PDP programs or the folks that have integrated benefits of medication coverage into their Medicare Advantage plan, hence an MAPD plan, Medicare Advantage Prescription Drug Plan. Our folks that we talk to in the veterans community, this is an important point to consider because these are two programs that they may or may not be examining year over year because they're comfortable with where they're at. Not using some of the information that's out there by the government or the Veterans Administration is something that we see quite commonly as well. So we need to be a source of information for these folks because they're not going through their Medicare and Va handbook. If they get it physically mailed to them or do a delivery electronically, they're not accessing information through the different tools that the government sets in play or the information that the government puts out there on the internet about their options. Same thing when we talk about the veteran community. The VA puts out a number of different pieces that help people understand, perhaps not in these formats, but we'll see in a couple of slides, well, in a few slides later, how they can understand what is available to them, the assistance programs that's there, and we're going to talk about that in great detail in a moment as well. Election periods, particularly pertinent to today's discussion because many people feel that even though everyone has an option to change their coverages during some standard election periods or through different special election periods that come about on a regular basis or one predicated by certain circumstances, some folks feel that the veterans have an SEP because they are a veteran. Not so, say I, and we'll talk about that in detail in just a moment too. We also want to make certain that we're able to deliver this information in the manner in which people want to receive it and to make it most effective. With some folks, that predicates an in-person visit, an appointment of sorts. Sometimes that appointment, however, can be done virtually, and we may see people pivot back and forth between these two delivery systems of information to get the detail out to the population we're addressing and make certain they understand it, and then to actualize it, to consummate that decision-making process with a change should it be in their best interest. Because folks are becoming increasingly digitally savvy, particularly the senior population that may not have played on the internet as much as some of the others, but they're being trained to do so. Over the last couple of years, particularly when the pandemic first hit, we saw the vast majority of visits being done telephonically or electronically. The technology is there to deliver a visit to a physician, be it a primary care or specialist, through different call systems, whatever it happens to be. That also carries over into preparations for hospital stays, visits to the dentist, even our celebration of our faith through services online. So seniors are becoming increasingly digitally savvy, and if we're able to deliver information in that fashion as well, we're well ahead of the game because it's a great point of discussion. It gets the information out to folks on a compliant basis and can really be time effective for us, time efficient, and once again, compliant in making certain that we follow through and discuss the programs in the fashion that our beneficiaries are looking for. So when we look at helping veterans with their health care choices, healthcare sometimes goes beyond just the base medical, even though we'll spend quite a bit of time on that. But we look at a population that's affected by additional governmental agencies beyond Medicare.gov and some of the state regulatory bodies. And that goes into folks that are, well, they're accessing benefits through the VA, so they're doing some detail with the Department of Veteran Affairs. And for a segment of the population that qualifies for it, we see TriCare for Life become a big factor in this discussion. So we have multiple sources of information, but also multiple means of delivering the information to the veterans population straight from the horse's mouth, so to speak. And this is a source of truth for us in many portions of our discussion. Important because, hey, it's a big part of the population. Across the country, we have different statuses or numbers of folks in a state based on age. And so it's important for us to realize that this can be a very substantial part of the Medicare market. And even if we're not pointing at it specifically, and we may not run across it all the time, it's important for us to be aware of what affects veterans and how we can access information to make certain that we're serving this population, which can be a great benefit to us, obviously, but even a greater benefit to the veteran population. And what we're seeing in this category too is when we cut it up by age, we see a substantial portion of the veterans population over the age of 65 because of all of the recent undeclared wars, shall we put it, and advances in advances in medical care. We're seeing a different sort of veteran come into play, in a manner of speaking. We have younger veterans now that may be disabled and eligible for Medicare because they have suffered substantial injuries and medical advances has increased their survival rate. You look at some of the detail on some of the older population, well, some of the injuries that are survivable now were not in the past. And so we're seeing a little bit different profile come into play with the veterans that we speak with. And it's also important to note that folks that are accessing care through the VA, well, they tend to be older, less socially economically well off than veterans who do not rely on the VA for care. So we have a subset that we look at, and we want to make certain that the people we deal with, well, we're speaking on their level, but we're also looking at their specific needs because there may be additional programs that we can offer to enhance their current living situation and make certain that we can deliver upon the maximum of care to this vital part of our population. They've sacrificed a great deal for us in many circumstances for our freedoms, and we want to make certain that we make them aware of all of the additional programs that they may be eligible for. And this includes a profiling based on income. Important for us because what we're seeing is almost half the population, much like what we see in the general Medicare population, that may well qualify for other assistance programs. So our discussion with this population may go well beyond, gee, what hospital do you use? Are you accustomed to that sort of conversation? Because that is a population that if they have chosen to pick up medications in the civilian population or they're outside of the VA, they may be looking at cost of drugs that can be partially subsidized or fully subsidized to a degree with some of the programs we have available with PDP programs and low income subsidy or Medicare savings plans, and help these people that are in a particularly vulnerable position. They're all across the country. It's like everything. You know, we see a sampling of the demographics wherever we are in this country, but it may affect your market more than some others. And it is also important for us to note that it's an aging population. I'm a history buff. minor in history, a semester away from teaching it, in a manner of speaking, as I got out of college. And when I first became involved in this market a long time ago, the majority of folks I spoke to were veterans from World War II, or possibly going into the Korean War. That population is passing. The greatest generation, as Tom Brokaw said, is becoming part of history, literally. And so what we're seeing then is a greater number of individuals who may be fighting through different health conditions because it's more survivable now, as I mentioned, with the medical advances. But we're seeing a shift of that population into a much younger population that may have different needs and be aware of different programs that they may be able to access. And it's important to note that we're seeing a smattering, in a manner of speaking, of folks accessing additional benefits outside of the veterans' purview. So we're seeing folks that are taking full advantage of the Medicare programs, not necessarily declining their Part B coverage, picking up some additional coverages outside of the VA purview in order to be fully covered wherever they live. And then a number of them accessing additional benefits because of a secondary job once they left the military, and the folks that may be economically disadvantaged, so to speak, and are eligible for additional assistance from the government. So once again, in each of these areas, we need to be aware of the ramifications of certain choices in the past, how we can address them, and how we can look at some options that are available to them to help them feel more secure and be more secure financially in their choices. This population, when they access care through the VA, are categorized in different groups, different areas of qualification. That means a number of things to the population as to, are they first served? Are they possibly suspect to losing some of their benefits, or is it more difficult to access their care moving forward? So a bit of a chart that gives you an idea based on age, income, and status within the profiling within the care delivered by the Veterans Administration. When we look at the population within the VA community, within the veterans community, I should say, we're seeing a big portion of it laid into the southern part of our country. Not that the northern part is not a viable market, but you'll see a clustering of the population where the percentages are much higher in the southern part, except for north central. So for those of us that work multiple markets, it's important to note that the different states may have a play as to some of the benefits that are available. So we need to be available to deliver that information, state specific, and be aware of it ourselves as we address this population moving forward. Because once again, a smattering as to where they are and how their circumstances affect them. And we see the percentages of the enrollees within the VA system that are accessing care also by Medicare. And that's important to note because we'll see in our discussion in just a little bit how these programs do, and more often than not, don't interact. Seem to be very persistent in making certain that we realize that a portion of this population also may qualify for Medicaid coverage or already have it in play. And much like the general population, we may see a number of individuals that qualify for this assistance and don't have it in place either. And so we need to be aware of the poverty levels, the different levels of assistance based on the federal poverty level as well. So the entitlement programs of low income subsidy to help with medication costs, Medicare savings plans to help with medical cost as well, and the Part B premium, as the LIS does cover Part D premium to one extent or another as well. So interacting between the private sector and those accessing care through the VA, well, much like we deal with the general population, it may be a bit of an educational process when it comes to, well, here's some additional help available to you. VA benefits overall, gee, they've been around since the end of the Civil War, when President Abraham Lincoln was addressing the need for care for wounded veterans. It's important to note that each state can set specific criteria for state-specific veterans benefits, and that some of the organizations that we have dealt with on an ongoing basis for this, um, we need to be aware of how the federal benefits emanate from the Department of VA hospitals into different caregivers into the community, and how a veteran's health status may have a bearing upon this. A poor way of placing that or describing it, but if a veteran was medically discharged and received a VA service connected disability stipend, time limits on multiple programs may be well affected. So it's important for folks to realize that if they are now entering into Medicare, the ever popular turning 65 market, that may be a subset where we need additional information for veterans that have left the service, gone into the private sector, maybe receiving retirement benefits, a subset of this. But this discussion speaks to the folks that have taken out programs through the marketplace and how they may be confused by some of the options that come into play because of that coverage as well. So we want to make certain that across the board, we have the information necessary to address the population. This is something we won't see as often as we do in other portions of the T65 market, but we need to be aware of how this is a topic of discussion with many of the folks that we visit with. Because if we look at this from a very high level, the Department of Veterans Affairs, they operate the country's largest, most comprehensive, integrated healthcare system through the Veterans Health Administration. This is important for us to note because veterans who have served on active duty for at least 24 continuous months and were honorably discharged from the military are eligible to enroll in the VA for health care. Some of them aren't aware of that process either. And so we need to be a source of truth for them across the board here. And how they come into play and how they can access the benefits, it depends upon where they are placed in different priority groups. These are groups that are accessing care through the Veterans Administration, 1 through 8, with 1 being the highest priority. That gives us greater detail as to how within this community we may have different concerns, and we need to be aware of how to address them. This is incredibly hard to read. I wasn't quite certain as to how to make certain you could read this more easily without chopping it up and really blurring it up, but this gives you detail on the different priority groups. And of course, the group with the greatest access and the highest connectivity to the system are the veterans with service-connected disabilities rated 80% or more disabling as the highest priority group. As you roll down the priority groups, you have people that are of different demographics, but also individuals who may have income that challenges use through the VA, high income, and folks that may be more suspect to losing some benefits, perhaps, depending upon funding in the future, or a more open idea as to accessing care outside of the VA system. And that is a changing demographic on an ongoing basis. Demographically, employees are getting, or enrollees are getting younger. It's like everything that we see. As I mentioned earlier in a slide, the older population is passing away, and we're seeing a greater number of folks entering into the VA system through some of the recent military activity, and we want to make certain that we are addressing these different pieces. So we want to make certain that all this information is made available to you, and we'll work with you to make certain that if you are addressing certain venues like a VA, a VFW, or different places like that, and you're looking for presentations, we want to make certain that we can help you in that regard, regardless of the underlying demographic. And depending upon who is active in some of those locations, we see in many of the VFWs and places like that, a lot of that may be the older generation that are right in line with some of the topics that we are looking to discuss. These are situations that we need to be really aware of, and the fact that all veterans are potentially eligible for care through this situation, but there are different requirements that come into play as to if they are and where they fall in the pecking order. So healthcare eligibility is not just for those who have served in combat. Other groups may be eligible for these benefits, and veterans healthcare is not just service-connected injuries or medical conditions. That's important to note because even though they may be in a higher priority group, other veterans are eligible for care through the VA, and that includes not just men. VA offers full service healthcare benefits to women's veterans as well, and we are seeing an increasing percentage within the military community of the female population. That sounded really coarse, but I'm trying to be very careful on how I word that, in the fact that we can't overlook this valuable portion of the veterans population and how we need to be aware of how we serve them as well. As I mentioned, that priority group uh, categorization is very important for us because some of the folks into different categories may be much more open to our discussion and much more in need of some of the benefits that we can make them aware of. And it is important to note that service connected disabilities can really affect where someone falls into these priority groups. And to understand that, we need to go beyond just medical care because a lot of folks that are veterans are accessing their medications through the VA. A great system to deliver that. It's really interesting as to how the formularies that are available through the VA and the general population are a bit different. I have an older brother who recently, well, he passed a year ago, he was able to access medications through the VA as a generic medication that weren't available to the general population in such a fashion. And we are seeing an increasing number of veterans that become aware of the fact that they may need prescription coverage outside of the VA to make certain that they can address certain circumstances that may occur into the future. And the folks that are in these programs through the VA, well, of the enrolled veterans who are taking at least one prescription drug in the last 30 days, approximately 2/3 of that population receive one or more of their medications from the VA. And these enrollees are reporting an average of 3.4 prescription medications from the VA. So it's a heavily utilized system, on particularly when you look at some of the maintenance medications or the drugs that we take for particular health circumstances we take every day. What we see is a need, perhaps outside the system, for medications for certain health circumstances that pop up or for one or another reason. A big thing that we come into play right away is some of the folks that are veterans may not be aware of the fact that they can have both Medicare and VA benefits, but they don't work together. Medicare doesn't pay for care received at a VA facility on a general basis. And in order for the VA to cover care, the individual must be receiving that care from a VA facility. In order to help with the cost and to have Medicare cover some of the care, that means if you go outside of the VA facilities themselves, it must be at a Medicare certified facility that works with the Medicare coverage outside of the VA. And VA does not pay for Medicare cost sharing. So those deductibles, co-payments, co-insurance that you see with traditional Medicare are not covered by VA if they're not being covered, or pardon me, not being administered through the VA facilities themselves, because it's a different system. It is important to note that there are certain circumstances where the VA will authorize services in a non-VA hospital, but it doesn't cover all of the costs during that stay. So Medicare may pay a portion of it, and that is why we need to make folks aware of the fact they may need that Part B coverage that they decline and how we can address that into the future. It's also important to note that VA health coverage isn't set in stone and isn't the same for everyone. So if they are in different priority levels, they may be receiving different types of care. And as the government says, as the military, the VA administration says, having both Medicare and VA benefits greatly enhances and widens the coverage available to the population. It's important to note that this can be particularly applicable for those that are suffering an injury or an illness and access care through an ER. How is that covered when they have just veterans benefits and they're going to a non-VA provider for this service? Well, the law says they take you to the nearest medical facility. And so folks that may not have those base coverages may well be subject to the penalties because they didn't enroll when they were first eligible. And we want to make certain that we can address how they become eligible and how we can cover some of those costs should there be a penalty and they qualify. So, is VA coverage a health insurance policy or an HMO? It's neither. VA benefits were established by federal law and regulations and are funded through appropriations. They're not the same as an insurance contract. It's also important to note that veterans do not pay monthly premiums to receive VA health care. And they'll tell you that, obviously, right up front. We want to make certain that they realize there are different circumstances where making that small monthly payment to the government for Part B coverage or perhaps additional coverage can really save them money in the long run. And it's not a requirement for veterans to use the VA as their exclusive health care provider. They have additional coverages. They may well continue to use services under those programs, but also access care outside of that. And the government says they recommend that if an individual has health coverage or HMO coverage outside of the VA, they should keep that coverage to provide them options and flexibility in the future. We need to make ourselves aware of that and how that can make a difference into some of the discussions that we have in play. We have some different things that are available for folks based on emergency situations, and we're going to go through some of the details on the particulars. I'm speaking in generalities yet at this point. Some of the folks that may have taken out Medicare in the past are looking at perhaps some financial obligations that are particularly strenuous and are becoming more pressing as time goes by, and they're looking to see if they should cancel or decline their Medicare coverages. And the VA doesn't recommend that that happens simply because they want to make certain that options are available to the population and that, well, there's no guarantee in the subsequent years that Congress will appropriate sufficient medical care funds for the VA to provide care for all of the priority groups. And that makes some of the folks in the lower priority groups much more suspect for elimination of their VA benefits. Not meant as a scare tactic. It's just the way things are in today's world, and we want to make certain that perhaps there are secondary sources of coverage that may be in a veteran's best interest. Once again, it's a diagnostic type of situation based on an individual's choice, and we need to make certain that they have the information to make that choice in an educated basis, and how they can realize that this will help them across the board, not just with medical care, but also with the medications that can make such a difference in our quality of life moving forward. Because there are differences in formularies in different health plans, but also, as I mentioned before, the differences between the formularies through the VA and those available at local retail pharmacies. An important point here too is during a certain perhaps medical condition, flu or cold, that they have a prescription that needs to be filled for that purpose. In addition to some of the maintenance medications, a lot of the accessibility to those medications may be well predicated by how close they are to a VA facility. And is it much more convenient and perhaps cost effective to go to the pharmacy down the street, and how they can help with some of those costs? And so we want to talk about that. We have folks that are kind of on different ends of the spectrum, and we see this in different healthcare delivery systems, be it traditional Medicare, PMA, Med Sup world, but also within the VA community, the veterans community, because some of them are quite pleased with the care that they're receiving through veterans facilities. Some of them like to access care outside of that system into the private sector, and we want to be able to recognize and deal with the options that they have available. Why do some VA users like using other healthcare services, and how they deal with some of the barriers to care through the VA? Well, Over 2/3 of them look at easier access to care based on the number of facilities that are available and that they perhaps have a provider in the community that they like and trust in the private sector. Appointment times can be of a big difference. In certain areas during certain times, you'll see that, well, gee, investigative reporters sure do like to see what is the quality of care that is being delivered through the Veterans Administration, and do folks actually even understand their eligibility for services within that community. So what we're seeing is a pretty good subset of veterans that are looking for easier access to care and perhaps establish that relationship with a provider that they like and trust. Because when they access care through the VA, the facilities there, they don't necessarily seem to see the same medical provider, a doctor, a PA, whatever it happens to be, on an ongoing basis. So establishing that relationship is very important to most of us, and that includes veterans. You do have access to guides that will talk to you and the veterans about the wait times at individual facilities. This is a valuable tool to use. You'll see the web address up here, and it gives you then an idea as to how someone needs to abide by or look at how long is it going to take me to get care at a facility. And this can be, as is noted here, a number one reason as to why someone would access care outside of the VA. So you have that tool available. It is important to note some of the things that interact between the veterans and Medicare situations, in the fact that the VA cannot bill Medicare for any services. However, by law, VA must bill private insurance plans. So those veterans that have Medigap policies may well see a billing on those policies through the VA. And even though prescription drug coverage through the VA is considered to be creditable coverage, it does not create a special election period for us to help them during lock-in. However, as we see in many circumstances in the Medicare community, they may well be eligible for a different special election period that would enable them to add to their coverages throughout the year. It is important to note, however, too, that the folks that have, excuse me, declined their Part B coverage, well, VA healthcare is not considered credible coverage for that, and they may well be subject to those penalties for not picking up Part B when they're first eligible. How can we deal with that issue? Well, many of those folks that decline the Part B coverage may have economic constraints placed upon them, and when the time was to make that decision initially comes into play, and if they fit certain parameters, some of the programs we have available will help subsidize not only the Part B premium, but also the penalties that are involved under Medicare savings programs. It is important to note, as someone mentioned in the question section earlier, that new rules are expanding access and providing more choices for veterans at non-VA facilities. And this includes folks that are doing so on a regular basis, or for those that are facing emergency circumstances. So we need to make them aware of the fact that Part B enrollment still may be in their best interest because they're accessing care outside of it, and the fact that the VA is actually encouraging veterans to enroll in Medicare. That choice and those options are very important to all of us as we move forward, because of some of the economic uncertainty that is faced by our increasing federal debt, and how our elected officials are going to choose to service that debt in the near future. Some hard choices are going to be made at some point in time, simply because of the burden that is placed upon the entire country based on that debt and the interest that it is generating. For enrollment into Medicare through the VA, well, VA folks, they're not required to enroll in Medicare. Well, none of us are, but the penalty that is placed upon us for making that decision is permanent, unless we can deal with certain financial circumstances that may well alleviate some of that pressure. And there are different options for a veteran to use that can help augment their current coverages without really changing a whole bunch of the delivery. So those folks that have chosen to decline Part B and then enroll in it in order to be eligible for additional assistance, additional coverages, or to be eligible for even an MA program, we may have plans there that can well take care of some of those premiums, but give them those greater options to access care, because VA benefits must be processed through VA providers. Keep in mind, referencing back a question earlier in the system, well, VA providers may well be within the private sector as well. And so we need to be aware of who those individuals are, who those providers are in the community, and that doesn't interact with Medicare Advantage or PDP benefits that need to be accessed solely through civilian providers. So there's a little bit of interplay that comes into play, and there's a whole bunch that doesn't, and we need to be aware of that. For someone who wants both Medicare Part D and VA coverage, the two don't work together. The VA benefits cover only drugs from VA pharmacies, and Part D plans usually only cover drugs from our pharmacies that are part of that plan's network. And that can be a big difference for these folks. So a veteran may want to, however, pick up a Part D program, particularly if they move into a nursing home outside of the VA healthcare system. And that's not an all-inclusive system, and we'll demonstrate that in a little bit. But it's also an important point because that may be how, once they go into a long-term care facility, how they're accessing medications through the nursing home. And it's also important to note that folks that acquire that additional assistance through extra help, low-income subsidy, that can make a big difference on subsidizing that additional reach into the community to cover their medication needs. And some of the systems that are put into play then, even though drugs are very reasonably priced through the VA itself, utilizing the systems that are there in play for those who qualify for that assistance, well, it can really decrease even the cost of those medications outside of the VA system. So when an individual is enrolled in an MA or PDP, the VA beneficiary can choose to have prescriptions written and filled by either a VA provider of pharmacy or a civilian provider pharmacy. However, the orders can't be crossed. So once a VA beneficiary is enrolled in an MAPD, that prescription written by that network MAPD physician, a civilian, well, it doesn't work to be picked up at the VA pharmacy. And sometimes the copay rates are lower due to drug classification in the VA pharmacy. So we need to be kind of shoppers between the two systems as to what is more effective for a particular medication, because the income stressors, the financial reality of the population, well, that copay difference may make a difference as to what's available throughout the month when it comes to the dollars that are there. Once again, they can be in both systems, but they need to be aware of how they are enrolled in both systems and what the eligibility criteria is for both. This is an important note too, because if a veteran has the private Part D program and the medications are accessed through the VA, does that apply to the true out-of-pocket cost that takes a person through the benefit periods within an MA or a PDP program? It's important to note that the medications that are accessed through the VA do not apply to that troop. And so that makes a difference when it comes to calculations as to cost of care. And we need to be aware of that. And there are certain circumstances where a veteran may consider picking up a Medicare supplement program. This is generally a circumstance for an individual that doesn't live near a VA facility, is enrolled in one of the lower priority groups and could potentially lose benefits, and want the options to use local doctors and hospitals that aren't participating in the VA system, which is a fairly general statement there. But it's important to note that a lot of this may well apply to folks that are in more rural areas or folks with particular circumstances. That's why that counseling, that visit with the veteran or the Medicare population at large is so important, because this is an opportunity for us not only to serve this population, but also to generate referrals through the manner in which we're delivering this information to a very crucial portion of our population. For folks that are joining an MAPD plan, it's important to note they don't lose even their TriCare for Life benefits, but they do add Medicare Advantage health plan benefits. And if an individual within TriCare for Life is accessing their medications in that fashion, well, they can also enroll in an MAPD plan and could be disenrolled from any standalone PDP plan they may have in play. It is, however, an area where many are looking to establish that relationship with that provider within the community, and they are continuing that relationship on an ongoing basis. I'm not about to say that the care delivered in a VA facility is not adequate or in some cases superior to other delivery systems, but you don't necessarily see that same continuous relationship with that primary care physician, and that can make a big difference. And we need to realize in many cases, additional benefits may be available to the population without additional plan premium, depending upon the area and the plan selection in the market in which they are living. So a little bit of detail here when we look at some of the benefit comparisons. I mentioned the fact that distance can come into play, the relationship with rotating specialists and the different things that come into consideration when we look at, well, do you need additional coverage? And then, of course, the medication formulary differences. One of the medications my older brother was taking, I just renewed it yesterday, and my healthcare coverage, it was $110 with my medication coverage. Now I don't have Part D yet, but the formulary that he had available through the VA, it made that medication available as a generic, or it isn't to the general population. So there are different folks that have medications available through the VA at a lower cost that aren't to the general public, and once again, some circumstances where those costs can be controlled in the general population where they're not within the VA. It is a very important point for many of these folks to realize, and it gives us opportunities to help serve this population, that dental and vision benefits are only available to certain qualified veterans. So those veterans that are interested or open to entering into a Medicare Advantage plan can access those benefits in many circumstances through those plans, but that may also be an opportunity for us to look at some of the standalone fee-for-service programs that address those needs, dental, vision, hearing programs that pay in addition to any other coverages that may or may not be available to our prospects and clients. It is important to note, too, that there are some variable charges within the VA system when it comes to hospitalization. A dear friend, a number of years ago, a individual who was fighting diabetes who wound up having a leg amputated, he went into the VA facility to have that done, as opposed to accessing things through his Medicare Advantage program, simply because of some of the cost differential that came into play in those circumstances. And what we're seeing now is many people, because of the increase of benefits in the MA plans since that time period, since that was, oh, good golly, 15 plus years ago, the benefits have changed and are greatly enhanced within some of the Medicare plans that make that decision a little bit of a different decision in the end. This is an important point. I mentioned it a bit earlier as well, in the fact that because they have VA benefits doesn't mean it's going to generate an SEP, a special election period for folks throughout the year because of the service alone. We find, however, as we saw at some of the demographics of the Veterans Administration, because of different circumstances, they may well qualify for different SEPs, different special election periods, outside of their service to the country. When we look at the CHAMP VA benefits, there's a lot of things that we can use, the tools that are available to us through the internet that helps us address some of these questions. And that includes a definition of what CHAMP VA is and how those benefits can be different for this community. It gives us the idea then that when you look at CHAMP VA and how it may or may not interact with Medicare and the different alphabet pieces that come into play, well, this is an educational process as well, because many of these folks have been accessing care through the VA for an extended period of time before they became Medicare eligible. And we want to make certain that we do some of the general educational pieces, that activity that helps them be aware of the different options they have outside the VA and how they may be a very valid way of accessing care. Because these folks need to be aware of the fact that, well, if they're eligible for Medicare Part A, do they need Part B to be eligible for CHAMP VA? In most cases, yeah, they do. They got to have the Part B that comes into place. And a lot of that depends upon when they became eligible for CHAMP VA, the time period that's involved there, and whether or not they are disabled or not, and how that may grant them earlier access to Medicare based on different health circumstances, like we see in the general Medicare population. And that the fact that some of the folks may be in a circumstance, well, they didn't work enough quarters or pay into Social Security, I should say, for the number of quarters that are necessary to get premium free Part A, and that may affect their decision as to whether or not they need Part B. So if an individual is over the age of 65 and never eligible for premium free Part A through Medicare, they don't need the Part B. They're going to access care through the VA. This is a crucial point because a lot of times folks will think, well, the VA is going to cover us across the board for our health care needs. Well, much as what the Medicare considers a health care need is mirrored to a degree within the VA in the fact that dental, nursing home care, hearing aids, eyeglasses, well, they may not have some of the coverage that they think they have presently, and are really receptive to some of the information we can deliver as to what they can get through the VA and what they can't in these circumstances. And that can have a big bearing as to their quality of life now, because we've seen through different detail given to us as to how dental benefits can really affect not only that directly needed service for that condition, but how that can also be an indicator of other healthcare conditions we need to make them aware of. Many conditions on a general healthcare basis may well be quasi-diagnosed through a visit to a dentist. You'll see that in many of the presentations we do on dental plans as to how dental care can affect an individual's overall health. And for most in the VA system, they don't get that help. Same thing comes across with hearing aids and eyeglasses, where they're only provided in special circumstances and are not for common hearing or vision loss. Well, gee, a medical condition, yeah, we can see that. But what affects the largest portion of folks in this category? Well, it's not necessarily a medical condition. It's just hearing and vision loss due to age or another factor, and they're not getting help in that area. So let's look at some of how this is addressed by TriCare for Life itself. And this is I'm running a little long here, so bear with me because we've got a lot of really good information coming up. But you have access to details on TriCare for Life. And these are important that you have these available so as you speak with a veteran, they realize that you're coming from the ultimate source of truth in this area. And that TriCare for Life beneficiaries, as you run across this subset of the veterans population, be aware of the fact that all TriCare beneficiaries must enroll in Medicare upon gaining eligibility in order to retain TriCare and TriCare for Life coverage. So a lot of times we'll run to folks and they'll say, well, I'm aging into Medicare, but I got TriCare for Life. I don't need this, this, and this. Well, the government will disagree with them. They got to have Part B to continue that coverage. Now, keep in mind, in many circumstances, like the general Medicare population, they don't have a premium for that Part A, but there are premiums that are involved for Part B, and they are, like the general Medicare population, based on income. So we need to be aware of the IRMAA effect, IRMAAA, and how that can affect their Part B premium. Because folks that are TriCare for Life eligible in many circumstances are higher income, and they may be affected by that. Um, when we look at some of the different pieces that come into play then as to how these programs interact and how copays and other things may be affected, we'll talk about that in just a second. So keep in mind, excuse me, TriCare is the healthcare insurance program for qualified qualified military individuals and their beneficiaries based on years of service. And this program and their beneficiaries, if they're on TRICARE and they have Part A and B, they can get, and in certain circumstances, increase their benefit package through these eligibility options. And TRICARE for Life is administered by CMS as well, so we need to be aware of that. We have detail on how to connect and get additional information and sources coming up in just a little bit. So in this circumstances, when you look at the coordinations of benefits, for most services, when care is received by someone covered by both Medicare and TRICARE for Life, they'll have no out-of-pocket expense. So after Medicare pays its portion of the claim, TRICARE for Life will pay for the remaining amount due on a qualified basis for services that are paid for by Medicare. So this, like a Medicare supplement program, the payment is dependent upon whether Medicare covers it and pays for it. So if Medicare doesn't pay for it because they decide that the care isn't medically necessary, TRICARE for Life will also not pay. Now, if a person appeals that decision and Medicare reconsiders, Medicare, you can go back to TRICARE for Life to get some additional coverage and they may consider it. So we need to be aware of the fact that this is an area, a subset within the military community that is a little bit different. Remember, the VA delivery of services is a bit different than TRICARE for Life. VA and Medicare doesn't interact. In this circumstance with TRICARE for Life, they do. TRICARE for Life is the secondary payer on these systems. It's also important to note that in reference to what Medicare does and doesn't cover, well, that follows into the TRICARE for Life payment system as well. So some of the things that are generally not reimbursable by TRICARE for Life or Medicare include acupuncture, experimental or investigational services, eye exams, and hearing aids. It's not an all-inclusive list, but we need to make certain that folks realize that TRICARE for Life doesn't cover some of the things that they may need as well. Hence the need for additional access to care, be it through a Medicare Advantage or Medicare program or a standalone program to specifically address that need. Now, these folks too need to be aware of the fact that they can enroll in MAPD or MA only programs, but since many folks that enroll or that are TRICARE for Life recipients, if they enroll in an MAPD plan, Medicare Advantage, prescription drug plan, it may affect their ability to access drug benefits for TRICARE for Life. So many of the insurance carriers out there pursue generally an MA only sales opportunity. What do you mean by that, John? Well, we're looking at Medicare Advantage plans that don't have the integrated drug benefit because they're accessing that care through TRICARE or that benefit through TRICARE for Life, but they're looking for additional benefits perhaps, or the subsidy, partial subsidy of their Part B premiums. So it can make a difference no matter what the income level is in an individual. Just because you have dollars doesn't mean you need to or you want to spend them. And so we see folks that are looking at this because it'll help with some of the enhancements of other benefits. If you look at MA programs, Medicare Advantage programs across the board, if they don't include the prescription drug plans as part of their benefits, you may see the medical portion be enhanced. And so that can make a big difference as to whether or not that program is of general interest as well. It's also important to note that if a TRICARE for Life recipient asked to be enrolled in an MA plan after being informed of the risk to their TRICARE for Life benefits, the sales agent must continue with the enrollment. At this particular point in time, I would make certain that either the presentation is being recorded or you write up a notice that is signed by the beneficiary that has them agree to or note that they may well be at risk to some of their TRICARE for Life benefits if they're going into an MAPD plan particularly. just to cover yourself. Some of the differences and some of the things that come into play, why someone will pick up an MA program, well, you got to focus on health and wellness benefits within the Medicare community, particularly within the Medicare Advantage programs that may not be available through TriCare for Life coverages, including some of the preventative screenings that make such a big difference in how people operate in Medicare by itself, with all of the preventative screenings that are available through just regular Medicare now, but how some of that may be enhanced by a Medicare Advantage program. It does, of course, give the individual a greater access to the provider community. So having folks available outside of the military treatment facilities, the MTFs, this can be a big consideration for folks, because remember, one of the reasons why they look at coverage outside the VA, well, access to care comes into play. It's also important to note that the emphasis on those preventative screenings and health and wellness, well, for some of the folks in the Medicare community, including veterans, may have chronic conditions that have targeted campaigns within these Medicare Advantage or Medicare programs to address those specific illnesses. And that can make a big difference into the quality of life for that veteran. And it may well help the individual when you look at some of the financial ramifications, some of the catastrophic ways of covering those costs, and how the give back benefits can help with the Part B dollars that come into play. This has some dated numbers in it, but I wanted this to be shown simply because we may look at some of the similarities in delivery of care between the folks that have just original Medicare and TRICARE for Life and those that are layering on or substituting the administration of Medicare Advantage plans in lieu of original Medicare administration. We'll see that big things that come into play, hospital stays of an extended period. Big thing now in the pandemic era where we have a whole bunch of folks with COVID that are staying in the hospital for an extended period of time that might come into play. And then, of course, worldwide emergency care. For folks that are TRICARE for Life people, well, they may be accustomed to travel. That may be something they're looking forward to in their retirement as well. And having the worldwide emergency care can come into play, because how is it covered by the different options that are available to them in their area? We also want to make certain that these folks have access to that ever important annual physical, and how that can be covered through additional programs that may not be available through TRICARE for Life for them. And that includes some of the base tests that are out there for certain health circumstances. Since we are seeing a larger number of females into the system and they may be more subject to bone mass loss, we want to make certain that those tests are covered as comprehensively for them, and that's not just placed upon the female population. We also want to make certain that those extras, those things that folks have the immediate and perceived need for, the vision, the hearing, the dental benefits, well, not covered with the original Medicare and TRICARE for Life, maybe well covered through an MA plan, maybe one of the ways that we can augment their coverages through some of the standalone fee-for-service programs we have available in our ancillary portfolio. We also want to make certain that folks that are diabetic, an increasing number of folks within our society, all those diabetic monitoring supplies can become expensive. How can we cover them more comprehensively? We also want to make certain that folks realize how these systems work and don't work together. So if they have TRICARE for Life, they enter into a Medicare program, and we have the different options that come into play. How do we make certain that those co-payments and pieces are taken care of through TRICARE for Life? Now, keep in mind, these are looking at medical expenses. So you look at some of those things that aren't covered by Medicare or aren't covered for TRICARE for Life, some of those co-pays within those systems won't be eligible for reimbursement. But the base medicals, well, you've got that lovely form 2642 briefly pictured here, and you see how lovely that is with all the fine print. Well, that may well be the completed form they need to cover those co-insurances or different things that come into play with Medicare coverages. One of the things we see in our good, the bad, and the ugly presentations when it comes to Medicare Advantage programs, The common holes within some of those plans may well be radiation treatment or DME, durable medical equipment, physical therapy, 20% coinsurance on some of those plans. That may well be covered by TRICARE for Life. That form can become very important and a big cost saving measure. Anytime a veteran with TRICARE coverage has other coverage, it's important, like any other aspect of our life, to properly communicate with those involved. So that includes the folks within the TRICARE system that are processing the forms that we're submitting. And communicating with them is important for us to help people realize that this is what's going to take care of that out-of-pocket expenditure across the board, however they're accessing it. It may require an additional form. There aren't a lot of forms in the MA system. That used to be when the Medicare Plus Choice plans came out. That was a big topic of discussion, limits to your paperwork. Well, this is a singular form, and knowing how to submit that and to whom can be a big difference. So we want to make certain that you have the information as to contact people within the different regions under TRICARE. And these are contact numbers that come into play into those different regions. Now, keep in mind, you're going to be receiving a PDF of this presentation or a link to one, depending upon the size of this, and it's massive. But you also have the video of this or the recording of this where you can snapshot this screen. So we want to make certain that you have this contact information and are able to supply this to the folks that you're discussing their different options with. Here you go into play. Because there are some folks that can access dental programs, here's how you find out within the TRICARE system who they are, how to deal with that, how to deal with the pharmacy benefits, who you contact for mail order within the medication system within TRICARE for Life. And those can be very valuable in making certain that these folks realize, okay, we may have a need for additional coverage, or we may well not. There are also additional support systems in the community that can help people in different areas. We want to make certain that folks realize that once they leave the military, or even during the time when they are in the military and are doing a side hustle, in a manner of speaking, how can we help them in that regard outside of perhaps activity that pays us a commission? Being that source of information can make a big difference as to how we are viewed, the moral responsibility we have, and ethics that we need to do in carrying through this situation as well. But this also makes us so much more referable. This is a really cool site. Make the connection. So you see the web address up here. This is a great way of making certain that we know of all of the additional assistance programs that are out there, the resources that are available through the U.S. Department of Veterans Affairs for the community at large. So a great way of making certain that you're helping to educate the population, and in doing so, making yourself that subject matter expert, in a manner of speaking, and a source of referability. So people that are of like nature can be referred to you as well. Some additional pieces, once again, on how to reach into the community for additional help, and some of the things that will come into play based on particular needs. What we see too, as we mentioned before, different carriers becoming very active in this space. One of the carriers that we contract with, and many of you do as well, is Humana, and they have pursued this market voraciously for a number of years and have different systems and presentations available to you to use within the medical community, the military community. So these are approved presentations, so you don't have to reinvent the wheel. You need your contract with Humana up and certify, or up and you're going through your certifications and you're set to do some different presentations. They also make available a lot of information through their newsletter and through their website, through a lot of the marketing material that helps you appeal to this population. Humana also schedules trainings on their own in this topic, and they do run, as long as this one is getting, much longer even, to deal with particulars and their viewpoint on how they approach this community. They do so very well. and they also do so on an informed basis. We see then that the different marketing materials that they have available through their systems can help you market into the community. So if you're working with a VFW, or you're working with another center of influence that draws the Medicare, let's look for the third M, military community, this helps you market in that space as well. So it lists some of the things that are of particular appeal to the population and realizes some of the limitations on the medical coverage of those costs through just the VA and VA facilities. When we look at too how this can affect some of the spousal or the children, we're going to deal with that in just a little bit, but that is also a topic of discussion and of interest to centers of influence. So you may have perhaps a senior center that is in an area with a lot of veterans that, well, perhaps the veteran has passed away, but the spouse still comes in and is alive and active, and we need information for them as well. So we're going to talk about that in just a second. Another carrier that's doing a good job in addressing this population is United Healthcare. Of course, the big gorilla in the MA space, in the Medicare space, has different details available as well, different presentations that are available to you. It's just an additional representation of or an example of how these carriers are addressing specific programs for this community. And it goes beyond Humana and United Healthcare. They do a great job in helping with the detail that's necessary to deliver a good, strong presentation, and also on how to market to that population. But Anthem does it, Centene does it with their different programs through WellCare programs and other programs that were labeled a different image in the past through Centene. But they're there with programs to help you address this community. So it's important for us to question our carrier representatives as to what they have in order to support this community. Because I'll look square in the monitor and tell you, hey, they want the business in this area. They want to make certain that they can support your efforts and are going to do so with every piece of support that they have available. How do we then make certain that we're doing the right thing? Well, it's like everything that we do with the Medicare population. It's not going in and just pitching one product. It's going in, listening, asking questions, making certain that we're considering that particular individual's current needs and lifestyle, particularly important within the veterans community. Are they looking to travel? Do they have needs outside of what is currently covered? In the past, many of us would say TriCare for life. Oh, you're good. You got the best benefits that are available. And they have a remarkable benefit package, but it may not be everything they need to suit their needs. Does that mean they need to enroll into an additional Medicare coverage? Not necessarily. You have those fee-for-service programs that can address dental, vision, hearing, and other needs in that area. And we want to make certain that we are doing what's right for the person that we're visiting with. And remind them that our services are available to like individuals. So who else do they know that are veterans? Because we tend to hang out with people that are like us. Who else can you help? That referral process can really generate not only additional business, but buzz within the community that will get us an opportunity to speak with individuals that are referred to us. And we may be in the situation where we're helping them with needs outside of base medical. So keep that in mind. This opens doors for other coverages, for life insurance, for long-term care, for those ancillary programs, the different things that help their need, help satisfy their need outside of just the base medical. And it's always important for us to thank them for their service. I really enjoy doing so in the community where, boy, you're at a pharmacy, you turn around, you see a person in a ball hat, as a matter of fact, that proclaims their veteran status. What a great indicator to say, hey, thank you for your service, and open a discussion perhaps thereafter. So we want to also make certain that as we consider the needs and lifestyle, we are discussing the good, the bad, and the ugly, or however these two lay out. Because like any situation, there's no one diagnosis for everybody. And we need to look beyond a mindset of, I'm out there to do just this. We need to look beyond that and look at how other aspects of our portfolio can help this population and how we can properly address those needs. Because as we've demonstrated earlier in today's presentation, some of these just aren't a consideration within their current benefits. So look first at, moving off of some of the base medical coverages, what happens when a veteran passes away? In 4 days, it'll be the 1-year anniversary of the burial of my older brother, who was a Navy veteran. How was some of that affected, his passing, as to what are the burial coverages with that? These are live links here, or were live links, and we'll make certain that we get you that information in this area, because some of the veterans are of low income and may not have some of the dollars available for a funeral, much like the general population. So have we discussed a final expense program with these folks? Because, oh, gee, I'll get married, ooh, Freudian slip there. I'll get buried in a veterans facility. Sometimes they don't want that. They want to be buried alongside their family in a civilian setting, in a civilian burial site, and we want to make certain that those cemetery access is there and that they can afford it. There are guides here that can really help with this discussion. So if you're active in the final expense community, this is something to be very aware of, because there are limited benefits when it comes to how the veterans can get additional dollars in this area. And some of it depends once again on that service related situation. Much like the priority groups in the healthcare, this is an area that is affected by, gee, was their death caused through service related incidents? Because, you know, that $255 from government benefits, well, that Social Security benefit may not be available to everybody anyway. And depending upon when the individual who is a veteran passes away, well, there may be dollar allowances for that burial and for a plot. Look at that, $1,600. We all know what it costs to bury an individual. If we're not, there's a lot of detail out there to give you the dollars that are in play there. That basic rounding up of $1,600 won't feed the bulldog. And that $300 burial allowance doesn't go very far. It won't even open the grave. So we want to make certain that we're helping folks in this area and making certain that they realize what comes into play. For others, there may be folks that look at, well, gee, I'm going to use a veteran's home in the old vernacular for my long-term care. A dramatic pause there, because even if they do qualify for assistance or care through a VA nursing home facility, they may not be being able to fund it fully. It may put them in a pecking order as to when they can get into one of these facilities. And even if they're of a high priority group, there may not be room in a facility in their area. So are they willing to go a distance for that care outside of what takes them away from their home and family and pay for it? Or if they're willing to wait for that care in an area in their current home setting, how long is it going to take to get in there? I know when my brother had his stroke and came out of the hospital and the SNF unit, there was a period of time where there wasn't a space available in a VA facility. So you have to take into account that time period. So are we looking at a long-term care policy overall, because there may not be a VA facility or they don't want to utilize it in their area and they can afford additional coverages for that? Or are we looking at coverages to help them bridge that gap between when they first need the care and when they're able to access that care through a VA facility? So this brings up the whole long-term care, short-term care situation. And we need to realize that there is a very small percentage of the veterans community that have a long-term care policy in play, even smaller than the general Medicare population, simply because they think they're going to be able to get that care within the VA facility. And we know that that may not be a possibility. There are options available to the population within the community as to where they can access care, either through community living centers that are through the VA medical centers, or through a contracted nursing home, or through a state veterans home. I was referring earlier to a state veterans home that my brother went into eventually. In these circumstances, the out-of-pocket expenditure can be different based on these circumstances. And we need to make certain that if we're active in this space, that we are well versed on the private programs that are available and some of the things that differentiate these systems within the VA system that a veteran can affect their eligibility and what it costs them. So in certain circumstances, the VA will help pay for veterans care at a state veterans home, and these are called per diem aid, and they must meet VA standards and make certain that we realize that in addition, the VA won't pay more than half of the cost of veterans care in these facilities. So what do we do to pick up the balance? We need to make certain that we are looking at the overall picture, what the costs are going to be, and then make aware of the fact that there's here yet another form through the VA that a person can use to apply for this aid in veterans care. VA Form 10-10EZ. So that additional information is coming to you as part of the follow-up too. It's available indefinitely, but the VA still have the forms that come into play. I mentioned that sometimes there's a wait to get into some of these facilities for care on a long-term basis. So the average wait time at these individual facilities, well, you got a website for that too. How long is it going to take to get into one of these in my market, in my area, the area that I'm targeting with this population? This is valuable information for you, invaluable information, in order to make certain that we're addressing the needs of this individual and how that can be affected by this time period. Keep in mind, that's not static either. We saw a spike both ways into accessing veterans care through a facility like this throughout the pandemic. And then, of course, how that affected some folks that said, well, we're taking my dad, my husband, my wife out of the facility, and we're going to care for them at home. Those costs, well, once you're in a facility and you have those medical conditions in play, that's like trying to insure a house when it's already on fire. We want to make certain that we're making people aware of their choices and the ramifications thereof. Now, we're finally toward the end of this, and I've gone extremely long. I apologize, but I wanted to make certain that even if you're not able to view this in its entirety, that you have the recording and that you can access other parts of it at a different time. But why do you want to do some of this through us? Well, we're going to help you make certain that you have the programs in play that you're eligible to offer in each of these areas. And establishing an agent profile through Assurance Bay can make a big difference in picking up those ancillary programs that may be a way of addressing those specific needs of the veterans community. So dental, vision, hearing programs, long-term care plans, all these different Medicare programs that may come into play. Accessing contracting through the system may well be a way of getting those programs available to you much more quickly. And we want to make certain that you're aware of that. Plus, it's a great place to storehouse all that information for you across the board. We do also offer discounted E&O for qualified agents. What is discounted errors and admissions, and what is a qualified agent? Well, qualified agent's one that has a contract with us. Discounted E&O is purchasing a standalone errors and admissions program that covers you for insurance programs generally across the board, no matter whom you contract through. So you can get a discount by using these through our carriers only, but you also have that coverage for all carriers, no matter through whom, at a slightly increase on the rate. But it gives you that protection that's required by the different insurance programs to offer many of these programs. And that includes a lot of the variable products where this is kind of a hard coverage to find sometimes. We do also offer discounted continuing education programs, bundling these CA programs through our association with WebCE to keep your license in play. We also have a way for you to increase your own benefit package, the one that you have on yourself, through a modified guarantee issue disability income program where you're paid a commission for selling your self coverage. Important to protect our ability to earn. Oops, pardon me. Much as where today's presentation is being recorded, past presentations have been recorded as well. And like today, they are available. Today's, once it uploads in the system, are available on our website and on our YouTube channel. So a great way to go back and re-review different portions, perhaps of today's presentation, or other ways that we can access tips on other insurance programs, carriers, marketing initiatives to help make our chosen vocation a success. I cannot overemphasize the value of Medicare Center to agents that are contracted with us. It's available without cost. An old MA guy, I have a hard time saying free, but it's free to agents that contract with us. It has an all-in-one universal login, so you have access to 3 coding systems: Medicare App, Medicare Link, and CSG, powered by Connecture, Sunfire, and CSG. It gives you that opportunity to stay in compliance by collecting that scope of appointment through different means and storing it for that 10-year period if we sell an individual or not. Important for us to establish in this area, through the use of that scope of appointment, the discussions that we'll have available for this community, because it references what we can talk about in that initial appointment and gives us the opportunity to set follow-up appointments for other areas of need. It allows us then to create that book of business within a CRM so we can manage and track our clients, do those annual reviews, stay in touch with them on a regular basis throughout the year to drive up our persistency and retention, and make certain that we're able to cross-sell different products of need to the community. It does also have a piece in here we don't reference on this slide of a resource folder that can help you with scripts and other pieces, different marketing initiatives that are available and warehoused within this piece. And that includes some of the myriad of programs that CSG offers outside of the quoting and compare functions with Medicare App and Medicare Link, where we have a cross-selling ability through the tools that are made available here. Keep in mind, if you were to contract with CSG individually, it's going to be a pretty pricey system as you add on these different components, all available without cost to our agents. Big thing here. Different things that are in there give you an ability to create heat maps as to what area is hot in what area and for what. Those presentations are already recorded through our association with CSG, available on our website and our YouTube channel. Now, there are some products that we're offering the veterans community that do qualify for us for additional incentives. Many of the ancillary products have additional marketing dollars that are available to you, some of it based on production. Not available through MA or PDP programs because max comp is set by the government there, but those additional incentives can make a big difference for our bottom line. They may also help us qualify for carrier trips and incentive programs within Premier as well, additional dollars and additional marketing support. We do have different lead programs that can help you reach into the community. The contact list available to you, butted up against do not call list, available to you at a low or no price that enables you to smile and dial. You got to do that with certain restraints because you can't smile and dial for MA or PDP programs, but you can for many of the other topics of great interest, final expense, dental programs, things of that nature, med sups, where it can place you in front of folks. I mentioned earlier that we have different presentations that can really help you within centers of influence in the community. That includes details on maximizing the return on your investment in retail marketing opportunities, some of which are still ongoing, by the way. Also, how you can address the community through their faith-based community. You can have programs for the veterans through their church and in organizations that are of greater size. This can be of a great appeal. Smaller faith-based families, well, that may be an additional interest because it may be an area that is heavily populated by the retired military. And also ways that we can help the providers that deliver upon the care that is covered by the programs we offer. I mentioned earlier that some of the MA programs are very very aggressive in pursuing this opportunity, and having the relationship with those carriers throughout the year may give us an opportunity to not only get the additional support to pursue this portion of the population, but it may entitle us to leads outside of that on a symbiotic relationship. You're helping them, they're helping you. We do have internet leads and direct mail support programs, the T65 locator I'll talk about, and then that referral program that I keep harping on to take that one lead and make it go forth and multiply. A link will be provided for you in how that works as well. That mail support, well, it's based on production, but it drives down that cost so you can pursue this on a consistent basis. And there are two programs available, one for the health programs and one for those that are pursuing final expense and writing that business. So you can actually get assistance on 2,000 mail drops as opposed to one in one category or another. We work through preferred lead vendors for that. We vet the organization to make certain that they have the systems to support you as you're paying for these outreaches, and to make certain that you are putting out letters that are compliant yet attractive to the community. These folks across the board are great to work with and are a great support system for you as well. For those of you that are looking for perhaps for a quicker response, because there's at least a 2 to 3 week turnaround on a direct mail campaign that you have on your own, you may have holes in your calendar you want to fill, or you want to do some things on a piecemeal basis. We do have an organization that allows us to access direct mail responses, never been touched, still fresh, varying in cost by area and type throughout the year, but a great way for you to fill your calendar in that area. Your marketers within Premier have that additional information, as they do with our internet lead programs, which are faith-based. Boy, I got that in my head. Facebook-based, and a separate program for both final expense and Medicare as well. So for those of you that are pursuing the final expense area, we've got an incredible department that can help you in that area. Dial in at 1-800-365-8208 can really get you in touch with a agent success manager specializing in that area, much as what you can do with support in the Medicare arena. At T65 locator, well, gee, that's available to you without cost as well. So as JJ Walker says on some of those annoying TV commercials, it's free. It's a system you download to your smartphone, register through your smartphone. They're going to verify that you have contract with us and give you access to this program where you can identify physically where these people live and breathe. So it gives you a way of reaching out into the community. And for those of you that are comfortable with door knocking, because you can door knock for certain situations, and there are some you cannot, please, by God's good grace, do not door knock for MA or PD plans. Good way to lose that contract. But you can for final expense, for Med Sup, for dental programs. And we see agents handle that and work this system very effectively. And we want to make certain that we're giving you the tools to be effective in that area, even more effective in that area, should you choose to do so. I keep speaking of how you can engage a referral system to make that one lead multiply. Well, that is also an area where you can go through, stay in contact with your current book of business, and get additional lead sources through that process as well. Good presentation. Even if I did give it, I want to make certain that you realize that there are ways of generating leads organically through the sales process and through what you've already done in making certain that this works. We go through all this in such great detail ad nauseum for some, but it's because we want your business as well. We want to be referable for you and to you, and to make certain that if you know of other agents in the community, you talk about what we can do for you and what we can do for them. But this is an area, particularly within the veterans community, where we can support your efforts, and we want your business in that area. So it's a thing you can put in play really quickly. You can add it to your personal marketing plan. Those programs that you set in play for AEP, for OEP, for lock-in, whatever it happens to be, on an ongoing basis. And if it is outside of the realm of medical benefits, well, gee, that's part of your marketing plan as well. And it's something that, as John Wayne said in the movie The Cowboys, you can slap a piece of bacon between that in that biscuit, saddle up and ride, because you're burning daylight. You can put this in play now, and we can help you do so. So I'm going to check really quickly to make certain that I might have covered all of the questions that we have. Let's see here. I think the one that we needed to address, and Angie, I apologize, I thought I had that in my head to do so, but does the wife of a TriCare for Life beneficiary get the TriCare for Life 2 when turning 65 and activating Medicare Part A and B? Yes, and we have details on one of those links that we included in the presentation, so it's there for you. Let's see, that appears to be the only one that we did not address at this point in time. So that leaves us with a second just to thank you. I want to thank you for the investment of your time today. I realize that we went extremely long. We wanted, however, to layer in some opportunities you have outside of the healthcare portion of this. We spent a great deal of the time with that, but you have opportunities in other areas, in the ancillary space, in long and short-term care, and in final expense and life insurance by looking at and examining an individual's particular situation based on what's going on in their world and making certain that we offer the programs that are available to them. So thank you for that time. For those of you that have done business with Premier Marketing and us in the past, I want to thank you for that business. For those of you that are considering do so in the future, I thank you for that opportunity. Once again, I thank you for your time. You can reach us through our toll-free number, 1-800-365-8208. If you're working with a agent success manager or marketer within our system now, that's who your contact will be. If you're not, we're going to set you up with a subject matter expert to help you in that area. You can do so through that call. You can access assistance through our website at premiersmi.com. Those lovely dot forms are there for you, and we'll make certain that we contact you in as timely a basis as possible. And then, of course, you can always reply to the email correspondence that goes out on a regular basis, but in particular to the one following up to today's presentation. All that said and done, once again, until we're able to visit with you in the very near future, I wish you good selling. Thanks so very much. We'll talk to you soon.